Yeah, so Arizona is facing a very serious COVID-19 crisis right now. The most important manifestation of this is our hospitals are full, and physicians are now having to make difficult decisions about which patients get care today versus those whose care is going to be pushed into the future. And this is only going to become more difficult and more agonizing as we delay our interventions.
This week, today, you and I are talking. It's Wednesday. There are 340,000 confirmed cases in the state, 6,700 deaths. What do you see happening over the next few months here if we don't get a hold of the situation right now?
Well, we're expecting that hospitals could be overwhelmed as soon as Christmas if action is not immediately taken. And so, thinking about what January might look like, that's way into the distant future. And the trajectory we are on currently is enough to put us in a very dangerous situation come the end of this month.
There have been many reports about how the number of deaths are decreasing or not as high as they once were when the pandemic began. Does that give you some hope?
It does. I mean, it allows us to carry a higher number of cases without the same consequences. And so, from the peak or the last surge in June or July, hospitalizations are down by about a quarter and deaths are down by about a half. And so, that's really great news. We have made important progress in the care of patients with coronavirus disease. Nonetheless, if we allow enough people to get infected, it will still overwhelm our system even if we are doing better at treating those that show up.
What should we be doing right now? You continue to hear from people who question the seriousness of this virus.
Right. And so my public health colleagues and I at the University of Arizona have recommended a 3 week shelter in place between Thanksgiving and Christmas. And the goal with this is really several fold. First and foremost is to reduce the frequency of human interactions. We need to keep people away from each other so that there's not an opportunity for the virus to transmit. Barring that, if people need to engage in essential activities, we need to reduce the density of interactions. We need to keep people physically apart from each other, and we need to reduce the duration of those interactions. They should be short, the business should get done, and people should move on and get out. And lastly, thinking about what we can do to make those interactions safer by reducing their exposure to infectious particles. So that involves wearing a face mask, performing good hand hygiene, having physical barriers. Those are important additional mitigation steps. Sometimes it's changing setting, moving from indoors to outdoors, increasing ventilation by opening windows. It's really this combination of interventions that's necessary. There's no one thing that will stop or slow the spread of the virus, but we need to be tackling each of these parts in the transmission chain.
In your opinion, time is of the essence.
It is of the essence. We have only a matter of weeks to act before this really overwhelms us. And there are a lot of policy options that can be taken to mitigate this spread. The thing that we have to avoid, though, is doing nothing. This outbreak won't collapse under its own weight. There's still too many Arizonans that remain susceptible to the virus that this escalation of cases could continue for many, many weeks and be many orders of magnitude worse than we're seeing now.
And finally, Dr. Gerald, what is your message to people who can't help themselves and they're looking forward to the holidays and being with family?
Yeah, and so it's very difficult for the general public to grasp, I think, this kind of abstract concept that we're in a crisis. Fewer than 10% of us require hospital care in a given year. And to think about hospitals being overwhelmed, it's hard for that to be salient to individuals. But it's not just individuals who have coronavirus that are at risk of not getting the care that they need, but any Arizonan who has a serious medical condition, heart disease, kidney disease, cancer, is going to find it more difficult to access the care that they need when they need it if we allow our hospitals to be overwhelmed with coronavirus. And so I think uh, all of us can recognize family members and friends who suffer from these conditions and making a sacrifice on their behalf so that they can have the care that they need when they need it is one way to help reinforce this message when it may not seem uh, personally at risk.
Okay, Dr. Joe Gerald, thank you.
Thank you.